Good evening, everyone, and thank you all for joining. Let me give a brief introduction about our speaker for today's session, Fitness with a Pulse. Dr. R. Vikas is a licensed PharmD with a postgraduate specialization in health and fitness management. He is a renowned health consultant, fitness educator, and public speaker who blends medical knowledge with lifestyle strategies to promote over wellness. Featured in over 15 interviews and podcasts, he is widely recognized for making complex health concepts simple and actionable. His expertise spans preventive and lifestyle medicine, clinical pharmacology, fitness and nutrition coaching, and mental wellness. Today, he is here to share his backed and practical approach to healthier living. Please join in welcome Dr. R. Vikas. Sir, you can start.
Yeah, good evening, one and all. So, as she has introduced as me, Dr. Vikas, just give me a second. So, the topic is about fitness, how the scenarios and situation in this society and generation going through. So, before that, our topic is fitness and how the health is pulse going through. So, why I have chose this topic. So fitness trends are everywhere, but not all are safe. So isn't it? So medical science can make fitness safer, smarter, and more effective. So I have prepared a PDF. So unfortunately, I couldn't share with you all. If it's important, then later I will share with Nikhil or someone else. So that would be posted in my broadcast channel, which is Vikasan official, my Instagram ID. So later you can all collect the PDF document. So now understanding how fitness affects health at a medical level and avoiding common exercises, related mistakes. I'm going to explain about it. So integrating fitness with medical needs and as well as the conditions. So where in this previous, since a year, we are seeing a lot of heart attacks in the gyms as well as on the, in the schools, colleges. One second. Yeah. So lot of heart strokes are we are seeing. So that would be the impact on fitness. So why it is happening? So only in the gyms and as well as only in the schools, colleges, in the premises of offices. So just because of stress and strain in the MNC companies. So coming to gym, so fitness and health. So we need to check vitals. How our body is supporting. So whether it is improving heart function and whether it is lowers the blood pressure. So we need to check. We need to check every week or every 10 to 15 days because we are consuming a lot of fried and like fried foods and lot of junk foods. So enhancing the insulin sensitivity, which is diabetic and prevention control. So just because of the sugary food also, that would be the main reason. And strengths bone. These junk foods and sugary foods, which are creating a lot of cholesterol. So as everyone are aware of it, and evidence from studies, 150 minutes of moderate. So evidence from the studies, we are seeing lot of the 150 minutes of moderate exercise per week, which can reduce the chronic diseases risk up to 40%. So where if we can check 150 minutes of exercise per a week, so on average in the day, which is almost 30 minutes, and Saturday, Sunday, like at least 2 rest days in a week. So that would be the chronic disease risk is up to 40%. So only working for 5 days would be great. but the excess amount of working and keeping pressure on the heart, that would be leading to this heart strokes and all in the gym centers. So, and real life example is a patient with hypertension. So recent case I have seen, uh, recent case which is a patient with hypertension improving with a tailored walking plus strength plan. So he has a different plan, but unfortunately, he is a hypertension patient, but he has focused only on walking. So he used to walk for 45 minutes to 50 minutes, then again coming to 20 to 30 minutes of cardio. So which is completely bullshit according to me. So where we have to focus on the hypertension and diabetes, I mean, at the same time. So keeping pressure on the heart is not at all good. And hidden dangers of unsupervised fitness. So coming to fitness, I mean, some we can see a lot of people doing a lot of mistakes in the gym centers. So just like wrong postures leading to the injuries mainly. So a lot of people doesn't have awareness how to posture. Like recent case I have seen in my gym also, so where the person was exposing his body and he doesn't had a proper posture. So at the time of posturing his body, so unfortunately he got collapsed just because of his hypertension. I mean, his blood levels got high up. Why it will be getting high? So the flow of blood, when the person had undergone the steroids or taking steroids, I mean, using shortcuts. So, so if the patient is going beyond, I mean, like going to in a shortcuts, like consuming, I mean, like taking steroids, so he will be having a blood pressure levels would be high. So then he was posting a wrong posture, then it has led to a serious injury, and he got fainted, and then again he rushed to hospital. And overtraining without adequate recovery. So we have a, for example, if we trained a chest muscle or biceps or tricep, whatever, if we are workouting, I mean, like doing workout in a day. So for example, if we can take bicep workout. So if I had a bicep workout today, so it will be taking 24 hours to 48 hours to get the recover. So muscles will be getting soreness, then it will be taking time to adequate the recovery of 24 to 48 hours of recovery period. So we don't want to, I mean, like we need not to worry about the recovery, but at the same time, at least we have to give for 24 hours of time for each muscle. I mean, like it might be shoulders, it might be chest, it might be tricep or whatever it may be. So we need to give at least 24 hours of muscle recovery time. Then again, following online trends without medical clearance. And I can see a lot of people who are following online trends. So yeah, we need not to go, I mean, like we need not to rush beyond the this following online trends. So if someone has consuming, I mean, if someone has taking the steroids, so if we follow the trend of them, so that would be definitely a wrong sign. Then again, medical risk. So a lot of people in the gyms. So currently we are seeing sudden cardiac events in people with undiagnosed heart conditions. Isn't it? Can someone respond to me? So we are seeing a lot of sudden cardiac events in people with undiagnosed heart conditions, isn't it?
Yes.
Yeah. So what I wanted to say is undiagnosed, like people who are people who are having at least hypertension or excess amount of fat cholesterol. So they need to diagnosis at least for 30 to 60 days. Then again they have to monitor their vitals. Then again they have to monitor their cholesterol levels, heart levels, everything functioning level. They should be thoroughly. They have to check the this type of if someone is facing any problems. So, worsening joint problems in arthritis patient who do hit without modification. So, at the age of 25 and 30, so a lot of people are suffering with arthritis. So, I have seen a lot of people at my same age. So, people 10 to 15% of my friends are suffering with arthritis. So, why arthritis would be at the age of 25, 30? So just because of this processed food, consuming processed foods, excess amount of consuming sugars. So that would be leads to cholesterol. Then again, it worsen to interrupt the nerve system. So that would be lead for the arthritis problem and then joints pains. Sugar is. Do anyone know the sugar will make joint pains? Some do anyone know this fact?
Yes,
Sugar will make joint pains a lot.
yes, yes.
And coming to safe fitness and the doctor's guidance for healthy individuals. So, as a fitness freak, as a doctor, so what I suggest for every individual who are performing in the gyms. So, at least warm up and cool down importance would be at least 5 to 10 minutes in the gym before starting the workout, and balanced routine, which would be strength training as well as cardio, and flexible workouts would be mandatory. So before starting the workout, so body should be flexed for 5 to 10 minutes, at least 5 minutes. Then again coming to strength training for 10 minutes to recover the muscle and to break down the soreness of muscles. So 15 minutes of flexibility exercises would be lot of helpful. Then again coming to workout, 30 minutes to 40 minutes of working out, and 6 to 7 workouts would be according to my suggestion, 6 to 7 workouts would be great per a day. Focusing on each single muscle, that would be far better. And again, coming to cardio. So based on cardio, 40 minutes of exercise and 20 minutes of cardio. Complete 60 minutes of exercise would be each individual, that would be recommendable. And 15 minutes of flexibility exercise would be recommended. So completely 60 to 75 minutes of workout is much enough. And need to check the progression, whether the gradual progression, which is every individual day, which would be 10 to 15%. So we need to rule out in a week. At least working out in a week for 5 days is far better, and focusing on the gradual progression, whether the progression is good or bad, and never use the shortcuts to get rid of it this. And for people with medical conditions, so as I said, 20 to 30 age group people are facing with arthritis, hypertension, diabetes, and as well as thyroid, even thyroid problems, lot of, and even hormone problems. So for those people who are suffering with, especially with diabetes, they need to monitor blood sugar before and after the exercise. That would be lot of helpful. And coming to heart diseases, people who are suffering with heart diseases, they need to check whether the intensity is low or moderate or under supervision. Supervision is nothing but whether they are going under a good treatment or not. So that would be especially important. And coming to arthritis, arthritis is nothing but pains in the joints. And arthritis is also just like same. We need to impact the exercises like swimming or cycling. That would be lot of helpful. People who are facing with the arthritis problem. So doing cycling for 30 to 60 minutes, doing swimming for 25 to 30 minutes would be recommendable as per my knowledge and as per the science. And medical checkups before starting fitness. So every, not only athletes, everyone who are starting the fitness, who are planning for fitness, who are planning for XYZ, like who are planning for running or who are planning for sports, especially, they need to go with few tests. For example, ECG, electrocardiogram. So that would be recommendable, and as well as BP. BP is nothing but blood pressure, where everyone knows. So monitoring blood pressure and basic labs. Basic labs are which is CBP or else complete urine exam or complete blood picture. So that would be not recommended, but still I can suggest. And these are the checkups before starting fitness is good sign. And coming to lifestyle integration for sustainable health. And fitness is not a 30-day challenge or 60 days challenge. It's a lifelong. So for challenging, if we can take a few bodybuilders, so they will be using shortcuts and they will be going beyond the health. I mean, like consuming steroids and using shortcuts in within 30 to 60 days, they will be getting bulk. So that would be highly, I don't encourage. That would be completely wrong sign. And the mainly who are planning, who has started fitness journey. So if they want, so as per the society, as per the generation, living for 40 to 45 years is great, according to my knowledge. So living to 40 to 45 age, like we sustaining for 40 to 45 age, so that would be highly appreciable. I don't think so we are going to stay for 60s to 70 age group. So we are consuming a lot of junk foods, processed foods. So that is leading to especially cholesterol. So LDL levels, HDL levels are getting high. So a lot of people are facing with the heart diseases. So that is leading to heart. So everyone is aware of this cholesterol in the heart, right? So should I explain about it, or everyone is aware of cholesterol in the heart, where arteries will be getting blocked with the excess fat cholesterol?
Really, we can give a brief, sir.
Okay. So consuming lot of fried foods, like processed food in the sense, French fries, burgers, so etc. etc. Deep fried foods. These are the deep fried foods. So consuming lot of Lays, etc. I mean, like these packaged foods, and consuming this oil foods, nuggets, etc., etc., blah, blah, blah. These bullshit foods are causing a lot of cholesterol. Cholesterol is nothing but fat. So the fat is gonna stay in the arteries, then it will be blocking our vessels. So that would be leads to heart stroke or getting chest, lot of severe chest pain. Then if you can take the ECG, if it's normal, then we'll be going through 2D echo. Then if it's again abnormal in the 2D echo, then we'll be going through TMT test, which is nothing but treadmill test. So treadmill test, if we are getting abnormal, so then we'll be going for the angiogram. So I know that people had this lot of times angiogram, angioplasty before. So angiogram is nothing but removing the cholesterol in the arteries vessels. So what I suggest is consuming these processed foods and consuming lot of sugars, beverages will be causing the severe cholesterol levels. So high cholesterol will be giving lot of impact on heart, and you will be getting lot of severe chest pain. Then you will be facing lot of heart diseases. So you will be recommended to reduce this with the high qualified doctors. So I suggest lifestyle integration and sustainable health for a fitness for lifetime. It's not for a 30 days or 60 days as a challenge. So everyone need to focus. So since 6 to 7 years, with the dedication, with the motivation, so I am into this fitness journey. Along with that, I have gone through this medicine. Then who are taking this as a challenge for the lifetime, they need to get the only thing they I suggest is the only dedication and the motivation. They need these two kind of categories to get the lifelong challenge. And the sleep is very important. At least 7 to 8 hours of sleep is mandatory. And focusing on nutrition. So working out is only 20% and nutrition is 80% as per my knowledge. Since 7, 8 years, I am observing, I'm noting out the points. So 80% we have to focus on nutrition. Nutrition is nothing but diet. So what we are consuming, and 20% I can consider for the workout. So rest is stress management. For those who are into MNC companies, of course, I agree. They will be having lot of stress and strain. Even the doctors has the stress and strain. So fitness, if you are joining the gym centers, so I can suggest, I can recommend the fitness journey to reduce the stress management and equality. I can say that nutrition and stress management are both equally important, because processing nutrition and going ahead with the stress management, so we need to manage the stress as well as manage the stress, and we need to focus on the nutrition part. Then again, 80% consistency is mandatory, and 20% of flexibility for the breakdowning of this muscle soreness. And you know what, technology tools, fitness trackers, lot of we got eye watches, we can track the heart rate, we can monitor vitals, as well as a few medical apps. We got a few medical apps, so we can also go check, and thoroughly we can check before workout and after workout. Just we can say that pre-workout and post-workout. So we need to monitor each single day. And coming to, so if someone is going through, I mean, if someone is going to gym, or if someone is going for yoga center, or if someone is going to etc etc, so we need to encourage them. We never discourage the person who is going to get trained with the etc part. I mean, like, who is interested in, someone might be interested in gym, someone might be interested in shot put, someone might be interested in cricket, so someone might be interested in badminton. So never ever discourage the person who is going with this passion. So always we need to focus, always we need to encourage the person who is showing his interest in particular things. And I am going to ask two to three questions. So first question would be, is morning exercise better than evening? How many of you are going to agree this? Need a right statement. So whether morning exercise is better or then evening exercise is better.
Morning. Think people can give their answer in the chat box for the question
Can
posted
you
by the student.
can you speak please bit louder?
I believe all can answer in the chat box because they're not, allowed to, I think,
Okay, so morning time
use
is
it
better than
further.
evening. So what I suggest is safest exercise for someone with back pain, or how do I combine gym workouts with yoga? So if you are having question, I mean, you might have a question. So doing gym and workouts with yoga. So yoga part would be completely different and exercising is completely different. And coming to this question, morning workout, if you are going for the morning workout, so you will be having a lot of peacefulness. But end of the day, what I suggest is doing workouts in the evening is far better after 5 to 6 p.m. 5 to 6:30 is the recommended time, because complete whole day you will be occupied with the works. For example, if you are working for some other company, or if you're a doctor, or if you're XYZ, so you would be occupied from 9 to 4 or 7 to 4, people who works in the morning shifts. So they are occupied with their works and they will be getting a lot of stress, lot of strain, and they will be occupied with different scenarios. So end of the day, as per science, as per previous science or as per whatever it may be. So 5 to 6:30, our heart rate would be completely calmed down and it would be normal in stage. So doing workout in the evening is far better than doing in the morning times. So morning, sir, lot of people will be going in the morning and lot of trainers will be recommending in the morning. So why are you recommending us to go in the evening? So 5 to 6:30, if you can also go with the I mean like science books or previous PDFs. So everywhere you can see that 5 to 6:30 would be the recommended time for the exercise. Because at that time, our heart rate would be completely getting calmed down and it would be 60 to 70 BPM, like that it would be. So that would be, I can recommend. So doing workout in the evening is far better than morning. And then again, can exercise replace the medicine? Can someone answer for this at least in the text or I mean in the with the audio?
I don't think so. Both should be there.
Yeah. So what I suggest is interacting with the person. I mean, like face to face. That would be good, and you will be getting a lot of knowledge. Okay. Then coming to, so can exercise will be not replacing with medicine. So exercise is completely different, and medicine part would be completely different. Exercising is completely external part, and medicinal things, the drugs whatever we are consuming, that would be getting recovered from internal thing. So that is different and this is different. Sometimes it can reduce medication needs. I mean, like I can say that exercising can reduce medication parts. For example, if we are focusing on fitness journey, so I can suggest hypertension and diabetes can be maintained in proper way. I mean, like not without using any drugs. So if you are focusing on medical journey with a good scenario, so we can I mean, like we can at least get rid of medication part, and never ever stop without medical advice. So the people who are taking hypertension or diabetes tablets with the fitness journey, so they need not to stop their medical things whatever they are consuming without the medical advice. I mean, like medical advice from the doctors, recommended doctors. Then what is the safest way to start fitness after 40? So
Right.
after getting 40 age, so what would be the safest way to start medical, I mean, like this fitness journey? Can someone say? So interacting would, I think so interacting is better because you will be getting a lot of knowledge.
So maybe starting with good diet after 40 because you need to take good care of your nutrition. Before 40, maybe your body is in such a state that can withstand the things due to the age factor. Yeah, after 40, yeah, nutrition is more important. And maybe a bit of exercise or yoga. Nowadays, people are saying you need to do meditation and yoga after 40 to have
Yes,
our
yes.
stress levels decreased. I think so. These are the things you need to take care.
Yeah.
Maybe walking, how walking will impact your fitness? People nowadays are doing, not brisk walking, also they do kilometers of walking, just slow walking. Is that really giving any impact on the fitness?
So recently I have did a reel on this walking session part. So people are seriously, people don't have aware of this walking and all. So daily in general, even if we can take in my family also, so even they do have a doctor, but never doctor never suggests their home is that would be the highly problem. And so people should get aware of this walking part. So walking on the cement roads, that is highly not at all recommendable. Walking on different roads, that is completely you will be getting lot of severe knee pains. And if we can see, since 1.5 to 2 years, 1.5 to 2 years max, so we are seeing lot of hip replacements and knee replacements. So people will walk for 15 kilometers, 10 kilometers, 5 to 7, 5 to 8. We can see after 40, 50s. So they will be keeping earphones, headsets and all. They will be going with the flow for the 10 to 15 kilometers. Someone who goes for the 15 kilometers, I recently seen one 54 years old uncle. So he will be going for 15 kilometers every day, up and down. So uh, one way would be 7.5 and other way be 7.5. So complete overall he is doing 15 kilometers. So I have seen BPM rate, and I have gone through his app. So he has a IE app. So I have checked it is. So people basically they have a target for 3,000 to 5,000 steps in a day. But I have noticed it seriously. It might be, no, I mean, like it might be joke, or it might be some, maybe you might be thinking, so might be this is not true. I have seen 16,000 step in a day after walking for the 15 kilometers. So later what happens after certainly, I mean, like after 6 months or 1 year, he has a habit of walking in the village. But unfortunately, he got transferred. I mean, like he got transferred from village, and he settled in city past 6 months ago. So he has started walking on the roads, on the cement roads. Before he used to walk on the mud roads. So walking on mud roads is different, and walking on cement roads is completely different. So what happens? So people go for walk on slippers. People go without slippers, without shoes for the walking. Few people will go with the using with the different kind of shoes. So what I recommend or what I can suggest is walking on mud is far better than on walking on cement roads or XYZ, any stones or anything else. So that what it will be what we have a lot of we will be having lot of issues with that kind of things. So lot of joint pains, arthritis issues, varicose veins would be also the thing we can see. So these like this, so we will be getting lot of issues. So we want to walk only on the mud roads, never use this kind of roads, or never walk on the what we can say this slippery roads also. So that will be that thing, we will be getting lot of hypertension also, because we will be walking forcefully. So that would be leads to high hypertension. I mean, like blood pressure would be high. So vessels would be opening, and it would be leads to high blood pressure. And again, so coming to weight loss journey. So weight loss journey, same as being healthy. So we can see a lot of people are with the obesity since years. I mean, like recent days, if we can see, uh, like 10th class, 10th or ninth or 10th class students who are facing a lot of problems with obesity. So fitness is about only the strength, stamina, and metabolic health too. But as well, we need to focus on fat loss journey also. So fitness is about strength, but the fat loss journey and the fitness journey is completely different. So focusing on this fat loss journey, we need to check how our blood vessels are working, and how much cholesterol does we have, and what is the weight and what is the age. And as per kilogram, we require 2 grams of protein. So in the fat loss journey, we also required in proper nutrition. People thinks that losing weight, we need not to go with the nutrition, or we need not go with the food. So people will stop taking rice, I mean like carbohydrates, and they will be focusing only on the salads. So that would be highly not recommended. So people who seriously wants to get rid of this fat loss journey, or people who are looking to get fat loss, so they need to focus on nutrition part. As I said in the previous, nutrition part would be 80% and 20% would be the fitness journey. So focusing on this medical equipments, and 80% consuming the nutritions where minerals, uh, proper minerals, proper fats, proper carbohydrates, proper sugars are we consuming or not. We need to focus on that. One second. Okay, no. Yeah. So coming to weight loss journey, as I said, the athletes or bodybuilders who are consuming steroids in the to get in a short period, in like 30 to 60 days challenge. So never ever fat loss journey, people should not run beyond the fat loss journey. Like taking keto, I mean like consuming keto diets, focusing only on keto diets, and focusing only on steroids part. So as I see, lot of people are going with the trend, so which is not at all correct as per my knowledge. So we always have consistency. We should have a consistency all the time, because consistency is the only key where we can get a result. So that is highly recommended, and focusing only on keto diet is also fine, but never ever go with the never ever go with the shortcuts. So do anyone have any kind of questions? Can go ahead.
There's a question from, I think, Akash.
Yeah, Priya, please go ahead. Can't hear your
Yeah,
voice
there's a
properly.
question. Yeah, there's a question from Akash. She's asking, like, can someone be thin at the same time they are fit,
Priya,
but still
unfortunately, we
unfit?
can't hear
So,
your voice clearly. Can you please speak a bit louder, or
one second.
yeah, sure.
There's a question from Akash. He's
Yeah,
asking, can someone be thin but still unfit?
I'm so sorry, your voice is glitching, Priya.
Still, one second.
Hello.
Yeah,
Sir, there are few questions
sure,
posted by a few people, so I'll be reading them and you can answer.
definitely.
Uh, Deepak has asked, what does being fit actually mean in your terms?
So, Akash, being fit is not just showing off our body. Being fit is, I can say, where we have to focus on hypertension part as well as a vitals part. So we are seeing a lot of cardiac arrests, I mean like in the previous or recent cases. So my answer for your question is, being fit is nothing but not showing our muscles, so not focusing on the biceps, or not showing up the body. So being fit is nothing but, are we consuming proper nutrients or not, whether we are focusing on stress management or not. whether we are sleeping for 7 to 8 hours or not is the only solution. That is called, I mean, fitness part is with the pulse. I mean, like the topic is also about that only, fitness with a pulse. So we have to focus on the vitals part. So that is the major part which is known as fitness.
And there's another question
Yeah.
from Lakshmikant. How important is diet compared to exercise for staying fit?
So, Lakshmikant, so you need to check your weight first of all. So, for example, if your weight is 50 kgs, so your body is required of 100 grams of protein. Sir, how we have to calculate? So, calculation, coming to calculation part. So, approximately your weight is 50 kgs. So, for 1 kg, 2 grams of protein is required. So the same way, 50 is multiplied by 2 times. So 50 divided by 2 is 100. So your 50 kgs body is required of 100 grams protein. So 100 grams protein, how you will be managing? So if you are going with the white egg whites, so each single egg is consist of 6 grams. So for example, if you are consuming 5 eggs in a day, like splitting it 3 in the morning breakfast and 2 in the night or post pre-workout as a pre-workout. So each single egg has a 6 grams. So 6 5 is a 30. So 30 grams of protein you have covered. Rest 70 grams you have to focus on. If you are a non-veg, so you can go with the breast part of the chicken. So if you are taking 100 grams of breast part, so you will be getting 30 grams of protein again. So egg for eggs 30 grams, and you already you have covered 30 grams. And then again, from for non-veg, as a non-veg you are covering for covering of 30 grams from chicken breast. So total 60 grams. Then rest of the 40 grams you have to focus on. If you can consume soya chunks, you can consume 100 grams of soya chunks. Then again sprouts. Then again consuming 2 bananas, 1 glass of milk. Then again dry fruits or whatever you can. So you have to calculate this, and the importance of diet is only focusing on weight it divided by 2 times, and then again you have to consume the protein part. So then again you will be getting fit. So no need of going beyond it, like consuming whey proteins and all. So if you have enough money or enough fit and fine to consume, so these things can be manageable.
Yes, and there's another question. Akash asked for, can someone be thin but still be unfit?
Can someone be thin but still unfit? So whether if the person is thin, we cannot consider him as fit or unfit. Whether the person is with the obesity, so we can say him fit and as well as unfit. But end of the day, focusing on the vitals again and again. So the topic is also on the fitness with the pulse. So why I am repeatedly saying is, so focusing on the vitals part. So whether we are fit or not. So generally, if we can see systole and diastole, 120 by 80 is the normal average. So that would be maintained. So the person who is managing 120 by 80 at the age of 40, 50 or 60, the person is called as fit. Whether the person is thin or fat. So we cannot say if the person is fat, we cannot consider him as unfit, because his vitals are normal. 120 by 80 would be systole and diastole blood pressure, and 96 would be oxygen, and heart rate would be 60 to 70. So of course he is the fit person. But he might be he may not might be run, but the thin person can run. The only problem is with the weight, excess I mean like overloaded weight. So that thing we have to focus. The thin person should be focus on the getting weight, and the weight person who is with the facing with the obesity, he needs to focus on the fitness journey and he needs to get thin. But end of the day, vitals are the important. Am I clear, Akash? Go ahead.
Uh, Amit is asking what's better for fitness, a long workout once a day or short workouts multiple times a day?
What's better for fitness? A long workout once a day or short workouts multiple times a day. So no need of splitting this. No need of multiple times in the gym. The person who is going for the stage appearance, the bodybuilder, he needs to go for the, he needs to split as a multiple times. 1 hour in the day, I mean evening, 1 hour in the morning. So if you are focusing only on fitness part, so my recommendation is doing workout for 60 minutes is much enough for one time. So multiple times, the recommended person is the only person who is going through athletes. I mean, like athlete parts who is going for any competitions, and the one is bodybuilding competitions. The person he can only go for the multiple times. So I recommend only one time in the evening. That to 5 to 6:30 would be great. Yeah, Sanjay, you are right. Morning time is better than evening. But Ramanjulu is saying morning is better. So as I said, if you are going in the morning, so for example, if you're going in the morning for 6 to 7, so then again you will be coming home, then you will be getting ready, then again you will be rushing out for the office or etc. So after reaching, I mean, like 8 to evening 5, 6, you will be getting lot of work pressure, or you will be getting stressed, or you will be getting strained. So end of the day, your morning workout would be not at all acceptable. So evening 5 to 6:30 would be the great time. Then again, 7 o'clock post workout diet would be highly recommended. That then again you can see the lot of improvement in your body. So if you're going in the morning 6 to 7, so you cannot finish up your post workout things. So you, because you need to take the breakfast things. So in the evening, so you can split the food part, diet you can be maintained. So at the time of 7, you can consume 3 to 6 egg whites. Then again after 7:30 or 8 o'clock, you can consume 100 grams of chicken. Then again at the 9 o'clock. So likewise, you can split. And end of the day at 10 p.m. you will be going to bed. So after post work, I mean like after the workout, you will be taking complete nutrient foods. I mean, complete diet food. Then again, you are resting your body for 8 hours. So then again, you will be seeing lot of improvement and lot of results. So morning, if you are going, then you cannot finish up your goals. Hope everyone is clear with this. And Revant Reddy, is it okay to exercise on an empty stomach? So working out on empty stomach is fine, but before going to workout, at least you need to consume black coffee because it will be giving you some energy, or it will be boosting you, and it will be you will be focusing on the particular workout. So never ever go completely on empty stomach because you will be getting fainted. So at least you need to consume one banana or magnesium. It will be containing magnesium, so you will be not fainting. And at least you should consume ORS. I mean ORS in the sense oral rehydrate solutions, electrol powder or rebalance XYZ, whatever you are affordable. So you need to consume those things. Thank you for your valuable information. Yeah, Hemasundar. What's the difference between natural sugars like in fruits and added sugars? So coming to sugar parts, how can I spot hidden sugars in healthy foods or drinks? So coming to natural sugars, And coming to added sugars. So added sugars, we will be seeing a lot of these added sugars on beverages part. So added sugars, if you can see 200 ml of beverage XYZ company, if we can take. So 4 to 5 grams of added sugars will on the label, they will be mentioning as added sugars for 4 to 5 grams of sugar. So added sugars is nothing but just like adding flavoring agents, and it will be having sucrose in this part, it added sugars. So basically why they will be keep, I mean, like writing as added sugars means they will be adding different kind of agents using with the low category sugars. Low category sugars is sugar is generally two parts. Sugar is divided into two parts. One is white and one is brown sugar. So brown sugar is basically extracted from the pure oriented exact sugar cane. They will be original sugar canes. Original sugar cane in the sense, at recent cases we are seeing a lot of artificial sugar canes also. So better to consume brown sugars where everyone is aware, but still end of the day we will be consuming lot of beverages. So like in fruits, we will be saying they will be injecting sucrose parts. So these sugary parts, if the fruit or beverage is a lot of sugar, then only we can be having. So the same wise, so lot of fertilizers are also lot of fertilizers are also having a different kind of sucrose parts. So that would be leads to cancers also. In recent studies I have studied. Is it better to do cardio before or after strength training? So as per my knowledge, as per science, as per gym trainers, doing cardio after completing of strength training will be primary, and training exercising part is secondary, and the third part is doing cardio for 15 to 20 minutes is recommendable, and strength training is for 5 to 10 minutes, and focusing on each single muscle for 45 minutes is far enough. So overall 60 to 70 minutes of working out in a day is much enough.
Okay, sir, thank you. We are glad that all of you joined us today.
Yeah.
And a special thanks to Dr. Vikas, sir, for the impactful session on fitness with Pulse. Before we close, I'd like to take a moment
Sure.
to introduce you to the platform that made today's session possible, MedWorld
Yeah.
Expo.
Yeah, sure.
So this is our platform.
Yeah.
And MedWorld Expo began its journey as a digital platform that brings together medical equipment manufacturers, distributors, healthcare professionals, and organizations to collaborate, engage, and thrive globally. Now it has transformed into a dynamic, intelligence-driven ecosystem designed to meet the evolving needs of the global healthcare community. And we have 6,000 plus healthcare manufacturers, 6,000 plus distributors, 5,000 plus healthcare service providers, and 17,000 plus 1,70,000 plus medical products equipments.
Okay.
Since you are the healthcare and medical professionals, I'd like to introduce you the benefits we offer. MedWorld Expo isn't just for organizations. We also help individual healthcare professionals discover opportunities, grow their career, and connect with the right networks.
Yeah.
Uh, we provide to build digital presence where you can create a professional profile to showcase your expertise and achievements. You can explore and apply for global medical job openings.
Okay.
And you can connect with manufacturers, stay updated on the latest innovations and products from suppliers. You can also access healthcare journals, articles, and news. Healthcare journals, articles, and news, insights, and everything. And you can receive tailored job recommendations based on your skills and interests. You can attend to CME programs. You can watch webinars, and you can attend CME programs. You can keep your skills current through continuing all your regular works. In short, MedWorld Expo is a complete career and knowledge platform for healthcare professionals, helping them connect, learn, and grow in global environment. Yes, sir. Thank you. Thank you all for joining.
Thank you so much, sir, for joining.
Thank you so much, sir, for joining.
If anyone has any doubts or anyone wants any clarifies, you can ping me on Instagram. ID is Vikas Sunny Official. Thank you so much, everyone. Very good evening.
Thank you, sir. Thank you, Vikas, sir, for giving this
Thank you.
wonderful opportunity. I'll share your Instagram ID and whatever the PDF that you have just sent me, I'll be sharing with them if required.
Definitely.
Yeah. Thank you, sir. Thank you so much.
Thank you, sir. Thank
Yeah.
you, sir.
Yeah.